Okay, who has perfect under eye skin, especially when they smile? Okay, almost no one. And the reason why is this skin is different than skin on other areas of the face and is more predisposed to aging as we lose collagen and elastin fibers, as we gain wisdom and have birthdays, as we have some volume loss and anatomical changes that can happen under the eye. But the good news is there's a lot that we can do in the office without surgery to help rejuvenate and prejuvenate the under eye area. That skin has an epidermis and dermis that are thinner than other areas of the face. It also has a different glandular and histological composition than other areas on the face, and the skin is different. And there's different treatments that we can do along the way to keep our under eye area nice, smooth, bright, and tight. By the end of this video, you'll be familiar with in-office procedures that we can use without surgery to help rejuvenate the under eye area, whether it's addressing fine lines, wrinkles, under eye hollows, dark circles, and you name it. Maybe it's a combination of these different morphological changes that you're seeing as you gain wisdom and have birthdays yourself, or maybe it's just an anatomical difference that you were born with that you want to correct. There's a lot that we can do in the office without surgery, and take it from me, I'm 47 years old and I've been doing under eye treatments to myself since I was in my early 20s, more to use myself as a guinea pig and practice on myself, but all those prejuvenating treatments that I did with unintentional anti-aging effects are now manifesting in my 40s, and I'm really glad I did. So I'm going to share some of those with you. I'll also share the latest and greatest technologies and combination treatments that we can use to rejuvenate the under eye area. And again, my content is non-sponsored, so this is just me based on my almost 20 years of experience as a board certified cosmetic dermatologist and the tried and true in-office procedures that give the most reproducible, amazing next level results and the happiest patients. All right, let's get into it. So there's different changes that can happen under the eyes, and some of these changes may just be anatomical, meaning you're born with them, like under eye dark circles or under eye fat pads, or changes that are now becoming more apparent now that we are getting older. And it could be broken down into different morphological changes like fine lines and wrinkles, which is usually from collagen loss or elastin loss. We lose 1% of collagen each year, and we lose 10% of our collagen each decade. So collagen boosting treatments that we can do kind of offsets that and puts us in a better position when we're younger, so that as we get older and we lose that collagen, you're kind of building your reserves and you're kind of stocking up so that you have wiggle room and you're slowing down that process. But usually fine lines and wrinkles are a secondary to UV light and photo damage over the years, other environmental factors, just with aging, exposure to environmental toxins and pollutants, blue light, HEV light from our devices, just what we eat, what we come into contact with, our overall health status, and many other factors come into play. There's other changes like under eye hollows that can happen from volume loss, that happens from the infraorbital fat pads moving and the fat pads under the skin changing and moving and separating and thinning out. You can also have under eye dark circles or vasculature that is secondary to ectatic blood vessels that you may not have seen before because the skin was thicker and was camouflaging it. But as our skin thins over time as we get older, the underlying vasculature shows through and we can present with under eye dark circles or like a purple bluish hue under the eyes. And then last but not least, there could be fat pad irregularity or herniation of the fat pads that happens as the skin thins as well. So all these different changes should be evaluated, and there's a treatment that can address each change. And sometimes people will have a combination of these different changes, and it will require a combination of different treatments to rejuvenate this area and make it look its best. So let's start with under eye fine lines and wrinkles. One of my favorite treatments to address under eye fine lines and wrinkles is laser resurfacing. Now lasers use photons or light as energy to help stimulate collagen synthesis to help smooth and resurface the skin. It's called resurfacing because you're literally doing just that. You're smoothing out the surface of the skin. Now that is in contrast to energy-based devices like Thermage, which stimulate collagen deeper into the skin. They don't affect the surface of the skin, but they stimulate collagen in the papillary and reticular dermis deeper in the skin, but that helps lift, tighten, and pull and smooth the skin. So there's a difference between the two, and I'll address each one. My favorite lasers for under eye rejuvenation to smooth out fine lines and wrinkles, or if you're younger, a younger beauty, then you want to do this to prevent and kind of offset the collagen loss that's going to happen in your future to keep the under eyes smooth and tight. And this is something that I did when I was in my early 20s, and it's really paying off in my 40s now, and I'm glad that I did. Now I understand not everybody's going to have access to this, and I was, a medical student working in a laser lab, lab and just had some free time and wanted to experiment on myself. And I was giving myself inadvertently under eye rejuvenating treatments, but I was more so just playing with the lasers and trying to experiment on myself. But I do think that it really does make a difference to collagen bank and to have collagen stimulating treatments at least maybe once a year starting early so that you set yourself up for a good position when you're older. Now, if you're in your 50s or 60s and you do have some fine lines and wrinkles under your eyes, it's never too late. Remember, skin is a very dynamic organ system. It responds to stimulus and it responds to collagen boosting treatments to help smooth and tighten those problematic areas. So Fraxel laser is probably my favorite treatment for under eye rejuvenation. Usually to get under the eye area, we have to put an intraocular eye shield in. If your provider doesn't offer this, it's usually because it takes a higher level of skill to understand how to put an eye shield in. I remember it took me years as a medical student, resident, and fellow to really get good at putting in those eye shields. And a lot of providers won't offer under eye laser treatments because they're not comfortable putting in eye shields. And you probably don't want them touching your face anyway, to be honest. So using a laser to help stimulate collagen and elastin synthesis under the eyes usually takes about 3 treatments spaced about 1 month apart. With a Fraxel non-ablative laser, also known as Fraxel Restore, aka Fraxel Dual, because there's 2 dual wavelengths with this laser, but it's the 1550 nanometer handpiece that usually is used for texture improvement and collagen stimulation. And usually 3 treatments are needed. And after that, you have beautiful collagen synthesis under the eyes, and the fine lines and wrinkles are either subsided or dramatically reduced. It may not erase them all the way if they're more on the moderate to severe side, but it definitely will improve this area. And over time, it will help reverse the clock and reverse those changes that have happened under the eyes. Now there's a CO2, which is a step up from Fraxel. CO2 is an ablative laser. Ablative versus non-ablative lasers just differ in the fact that the ablative lasers vaporize the tissue. It actually removes the tissue in fractionated patterns. So it's fractionated, meaning it's not taking the full surface of the skin away, but it's basically taking a fraction, almost like little dots that maybe can treat a 30 to 40 to 50% density, and basically removes that tissue. The non-ablative lasers just heat the tissue and stimulate collagen synthesis from the heat activity, but there's no tissue removed or vaporized as it is in an ablative laser. But I usually go back and forth between non-ablative Fraxel and ablative CO2. The difference is CO2 is a little bit stronger, but their caveat is that there's a little bit more downtime and it's a little bit more spicy during the treatment, but patients are usually very comfortable just with topical numbing being applied 1 hour prior to procedure. So next up are under eye volume loss or fat pad herniation. Sometimes people will have infraorbital fat pads or like that puffiness, or there could be like a tear trough area where there's like a separation between the eyelid cheek junction. And this happens as the fat pads under the skin can thin and separate over time. And as the epidermis and dermis thins, the topography of the underlying structures of the eye become more apparent. So usually the way to resolve this is by doing a little tear trough filler. Now I know we're kind of in an era where we're shying away from tear trough filler. Many people in aesthetics weren't properly trained and were doing too much filler too fast, and everybody had these pillow faces and just way overfilled. And so now we're shying away from that. But when it's done correctly with the right filler and the right technique, it's really next level results with respect to correcting the topography of the eyelid cheek junction without removing the fat pad, but almost filling in the volume depleted area underneath that fat pad so that there's a smooth transition between those 2 cosmetic subunits of the under eye and the cheek. Now, I understand a lot of people want to shy away from filler. I actually, in my practice, and as for myself as a patient, I've shied away from filler over the last couple of years as we entered and are hopefully exiting this epidemic of these overfilled faces. But there are now things like biostimulatory, easy gel, and other blood products that can be combined with biostimulatory effects to provide a scaffolding for blood products to kind of safely be injected under the eyes. The problem with PRP or PRF, which are non-HA filler alternatives, because they're using your platelet-rich fibrin or platelet-rich plasma, which are your blood products, is that those blood products like to be intravascular. They like to be inside the blood vessels. So if they get injected under the eye, they quickly get sucked away by the blood vessels and circulated out. So the results don't last for more than a few weeks in most cases. Now, there's some people that say, well, PRF and PRP, even if it doesn't stay under the eyes, there's some growth factor stimulation of collagen, but you might as well just put growth factors or peptides on your eye serum and have a much easier time with stimulating collagen through that mechanism of action. But using easy gel or a biostimulatory effect like Easy Gel, or there's many other companies that are having their own formulations now. It's still a newer technology. I am actually just waiting to have this introduced into my office because I really want to see the longevity of Easy Gel, which is basically your own blood products mixed with some type of biostimulatory component that's going to provide a scaffolding so that the proteins and the products stay under the eyes, because the biggest caveat is that it doesn't last as long as filler does, which could last about 2 or 3 years. But filler comes with its own set of complications too. There could be migration, there could be the Tyndall effect where you actually see the filler through the skin. There's many complications that are associated with under eye filler. So this Easy Gel or equivalent biostimulatory blood component products that could be used under the eyes may be a safe and effective alternative. And I'll be back with the verdict on my outtake on the results of that, because again, I'm non-sponsored and I only recommend treatments and products that I see real life results, and not because I'm in contract with some company to do so. Okay, under eye dark circles. Now, people who have dark circles under the eyes, it could be either from melanin distribution or it could be from the vasculature that has like a blue-purple hue. And this can happen from thinning of that skin over time, which is very, very common. It can also be accentuated by allergies, lack of sleep, malnutrition, where sometimes we see our patients who are on Ozempic and Ozempic equivalent medications or treatments, they're losing nutrients and they're getting that kind of like hollow, sallow look under the eyes. And that is just from volume loss with the showing of the vasculature under the eyes that can give kind of that bluish discoloration. Now, if it's from that, usually vBeam will address the underlying vasculature. vBeam laser usually takes 3 treatments, again, spaced 1 month apart. That's usually how lasers work, to help address the under eye dark circles and to help brighten up the under eye area. And we have a lot of success with using vBeam for under eye dark circles when it's secondary to thinning of the skin or vascular ectasia underneath the under eye skin that kind of gives that bluish discoloration. It responds really well to vBeam. Now, if you have hyperpigmentation with actual melanin, and the way you can kind of assess for it is you take your eyelid skin and you kind of stretch it out. If it goes away, it's usually the vascular component, and that's usually amenable to treatment with vBeam. If you stretch it out and that pigmentation is still there, that's usually melanin deposition. And in that case, we'll usually use either a clear and brilliant laser on the 1927 nanometer handpiece option, because there's 2 wavelengths for that laser, or the Fraxel dual on the 1927 nanometer handpiece. And those are the 2 safest, most effective ways to treat under eye hyperpigmentation that could be more of a genetic predisposition. So in addition to lasers, which use photons or collimated light in a certain waveform, there are also energy-based devices which stimulate collagen in a different mechanism of action through heat. Now, that heat can be delivered in energy in the form of radiofrequency, microwave, ultrasound, microfocus ultrasound. There's a ton of them out there. Thermage is my favorite. Again, I'm not sponsored by the company. I just really love the machine and I get reproducible results and very happy patients. I've done it on myself 4 times in my lifetime, and I'm glad that I did. What Thermage uses is heat in the form of radiofrequency to help stimulate collagen and elastin synthesis. It usually takes about 2 to 3 months to notice results, and the results continue to improve up to the course of a year. Now, the way Thermage works is here's the skin, here's the handpiece transducer. It creates an arc of radiofrequency that provides heat, a heat source underneath the skin that stimulates the fibroblasts, the collagen producing cells, to produce collagen, which helps lift, tighten, smooth, and pull the skin in a good way to make the skin tighter and firmer. And sometimes what we'll do is we'll combine Thermage with Fraxel, which we call Thermofax, because Fraxel is going to stimulate collagen superficially. Thermage is going to stimulate it more deep, and you're going to get a 1 + 1 = 3 synergistic effect. So usually, typically what happens is we'll have you come in, we'll do the Thermage, and then we have the numbing placed, and we'll do the Fraxel in the same treatment session. Now, if you need a second or third Fraxel treatment, that is all dependent on the patient's response, which usually has to do with the level of severity of the under eye fine lines and wrinkles. How much laxity is there that we need to correct? But for all intents and purposes, usually it's a Thermofax once, and if someone needs a little bit more Fraxel or a third Fraxel treatment on top of that, that's always up to them, and beauty's in the eye of the beholder. So we always want to not do too much, but just kind of do a stepwise approach to rejuvenating that area. So last but not least, neuromodulators. You can use Botox, Daxxify, Dysport, Xeomin. There's so many different neuromodulators on the market. Now, the under eye area is a tricky area for neuromodulator because usually when we do the crow's feet, we do an injection point here, here, and here. If somebody's not doing that, they weren't properly trained and run out the door. But that's the traditional way to decrease the crow's feet in the periorbital area. And there's a muscle called the orbicularis oculi that goes around the eye, and you want to target it at these 3 injection points. If you only do 1 out of the 3, then sometimes the skin bunches up on either area. Now, the under eye area is typically a no-fly zone for Botox, and the reason is it can change the shape of the eye. It can cause like an ectropion, which is when your eyelid margin is not touching the globe of your eye, and you can get a corneal abrasion or a corneal ulceration. But usually if we do it under the eye with an astute provider, it's a very precise injection point, and you have to be evaluated. If you're a patient of mine, you know I always have you animate with a mirror before I inject you, and if you're a candidate for it, we go for it, and if not, we don't. And it just comes from years of experience and understanding anatomy and knowing, you know, where to place the Botox and to not do too much, but just to do enough. So sometimes we'll do a little bit under the eye. Sometimes this is called jelly roll Botox. You'll see it on TikTok where we do a little bit right under the eye to help with that little crease that's right under the eye. But that's a very high risk area for ectropion, or where the eyelid margin doesn't touch the globe of the eye. So your eyes get dry and you can have, you know, ophthalmologic complications like a corneal abrasion or ulceration. So be really, really careful. Only go to an astute provider with that injection. And also doing the bunnies. This is called the bunny lines. Botox right here. This is the nasalis muscle. And because you can't really inject in this area, you sometimes can kind of cheat by injecting in a safe area, which is the nasalis. Sometimes we'll do 2.5 units on either side, or 5 total. And that will help with decreasing the crepiness or the under eye fine lines and wrinkles here by injecting safely here, and kind of like faking or cheating a little bit to get to this area without actually injecting that area. Now, sometimes if you inject this area, you can affect the lacrimal gland, which is the tear duct system, and it can also decrease the mechanism in which tears are drained from the eye. So be really, really careful. If you're a provider and injector who follows me, never overdo that. Go to a course. Please understand anatomy and where the no-fly zones are for the under eye area for Botox, because you can actually really have a lot of complications if it's not done correctly. But for the most part, usually can do a really, do a great job of like kind of helping reduce fine lines and wrinkles under the eyes if you're the right candidate and anatomically set up to be a good candidate for it. So whether you look in the mirror and you see fine lines, wrinkles, volume loss, bags, dark circles, maybe you see 1 or 2 or maybe all of these components, these are the treatments that are going to address each one. So there's not one-all cure-all treatment that's going to make everything better, but when you know what you're looking for and you know what you're correcting, you can be very methodical about your approach and the targeted mechanism of action that you're using to address these changes. All right, so that's all things under eye rejuvenation. Hopefully you guys found this useful, and we'll see you next time.